Today, we're going to talk about some of my favorite ways to use a Theracane or shepherd's hook. One of the nice things about using one of these tools is you can keep your body in a nice ergonomic position. So that way, while you're trying to work on some tension or some painful points, you aren't fixing those, but creating other issues in the meantime. So some of the most standard ways to utilize a shepherd's hook are going to be for the mid, upper back, for those nagging muscle aches after a long day of poor posture at the desk. So you're going to hold on to, stick wherever you feel convenient. You can leverage each of these different levels as feels best to you, finding that spot where you feel that muscle knot that's just hard to get to throughout your day. Then what you're going to do is push the nodule in the back by using your arms. If I want to take it to the next level, I can just move my body around, move my head around, find the spot that seems to really increase the discomfort the most. You can also use this on the upper traps. Grabbing right into that upper trap, taking my head away, turning it towards that same side. Great stretch for your right upper trap. Another position to utilize this for is going to be for your subscapularis muscle, a super challenging muscle to get to. But those of you with shoulder pain, this is a great spot to do. So you're going to push this nodule right into the armpit. Imagine you're pointing it out towards your shoulder blade. Now I'm going to leverage that with my other side hand, my left hand in this case, right down here, pushing up, letting my right arm be completely relaxed. Here you're going to feel quite a bit of discomfort. That might be radiating down your arm, or it might be local. Now, no matter where you're working with a Theracane, just like we say with lacrosse balls and foam rollers, we want to stay on that spot until the pain goes down by about 50%. Now, most studies have shown that takes about 3 to 5 minutes. So once you've gone down by 50%, go ahead, dig around, find another spot. Great, great activity here for subscapularis release to help out with shoulder pains. Now perhaps you have a nagging mid-back pain. Wrapping it around to that side, pulling through, supporting however you like to get as much depth and pressure as feels right for you. Again, you can move your body in any which direction, trying to prevent any other injuries from happening, but finding that spot based off of where your fibers are most tight. For diaphragm, we like to go onto our back, bend the knees, use this part to hook underneath our rib cage. Take a big breath in and out. As you exhale, get this to dig right underneath the rib cage, not on it. You want to make sure you're off the bone. And at this point, I'm pulling the cane upwards, holding it in this position as I continue to breathe, as we release the breathing muscle, the diaphragm. From this position, I can also get into my hip flexors. Keeping the knee bent still, we're going to drive into right near the hip capsule itself, right around the belt line. Again, leverage whichever point you want that feels right, figuring out the angle that feels right to you as well. For most of these, I like to push towards a bony structure to kind of pin that tight muscle against the bone. Now, if this feels great for you, fantastic. Stay right here. And ideally, we're at about a 6, maybe a 7 out of 10 for pain. Anything above that could actually just aggravate things, cause them to tighten back up, and you do not heal up at all. Now, if you need to increase this at all, you can start to take your leg down and bring it back up. So some active release to your hip flexor. Now we know this is the lower portion of the hip flexor that we work on in clinic. You can also start to go up more into mid-range, into your iliopsoas. Same concept. No, you're not going to damage your organs through this. Just use some common sense. If you start to feel any sharp pains, take some pressure off or fully stop until you're able to come to the clinic and ask us for some advice. Now let's say we want to get into our quad muscle group. One way that we can do that, nice straight leg to take the tension off. As you've seen for all these exercises, we want to start in a position that is released and relaxed. So for the quad, we want a straight leg. Find one of those tight spots. You can use any which of these knobs that you would like to utilize. You can even leverage more weight if you can handle that, supporting down at the bottom by the tight muscle and just pushing down with all your weight while I'm keeping my spine upright. perhaps I want to get into more of my inner quad or the sartorius muscle, I can get myself into more of a bend knee figure 4 90-90 kind of a position and push directly into that muscle, traveling up higher into my thigh. I can also get into my shins. If I'm feeling, after a long run, perhaps I'm feeling some more achiness through there, bringing that nodule right into the tibialis anterior muscle, all with the same premise that we've been doing all this time. So really play around with it, move the body around, find your tight tissue, apply a pressure that is allowing your body to stay in a nice ergonomic position. Be about 6 or 7 out of 10 for pain at maximum, and stay on that position until the pain goes down by half, which again, most studies have shown takes about 3 to 5 minutes. That's going to allow the muscle to fully relax and for it to elongate, so you're going to start to feel more mobile, reducing pain, reducing tension, overall improving your posture. This is also a tool that many people use in a warm shower or bath. So it can go in the water when your muscles are nice and relaxed through some hot water. So feel free to utilize that as well, okay? Otherwise, if you have any questions, please make sure to contact us at MyoLab and we'll be happy to answer them. See you soon.